Beauty means to me, it means whatever the person holds it. It's saying, hi, I'm here, just a glow to their eye, oh my gosh, I don't know. Beauty means everything. It's literally Bella. Bella it means beauty. So,
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Rubi Heredia, who is a board-certified nurse practitioner and who began her career as a critical care nurse, which developed the meticulous attention to detail that still defines her work today. In 2022, she founded Bella Ruby Aesthetics in Waco, Texas, where she operates as a proud solo provider, delivering highly personalized aesthetic and wellness care. Ruby is known for her precision, compassion, and ability to create natural, beautifully balanced results. As a Spanish-speaking practitioner, she is committed to serving the often underserved Hispanic community, helping clients across treatments and resources they previously didn't know were available. Ruby brings expertise, artistry, and heart to every patient she serves. So Ruby, welcome and glad to have you here.
thank you very much.
Yeah, so let's start
Glad to
with
be here.
let's start with this, Ruby. How did you first get interested in the medical field?
Well, I started out very, very young. I always knew that I wanted to be in the medical field. If somebody was sick, I was always wanting to care for them, like, oh, let me check your temperature or something like that. And my mom said when I was very young, I always told her that I was going to be a doctor, a nurse, or something. I started out in high school with a CNA program, and from there, it grew into me continuing into the nursing career. And so a few years in, I was like, I'm ready to take that next step, be a nurse practitioner. And so I finished that a couple of years ago.
Okay. And so then what led you to transition over to aesthetics? Because I mean, you were doing critical care. So what
Yes.
led you to want to switch over to aesthetics?
It's kind of a weird story, I guess. I never thought that I would do aesthetics in a way. I never thought that I would be a business owner. I always thought I was going to be a critical care nurse, family nurse practitioner, and then all of a sudden, it just kind of geared that way. It it was a point where COVID happened, and I was an ICU nurse, and I was like, man, this is a lot. And so I transitioned out of the ICU critical care area, went into a more surgical trauma situation, which, like, is it less intense?
Yeah.
No, it wasn't. It was just a little bit different. And then from there, I was like, I can do more than just be nursing. So I went into a nurse practitioner program. And then, that was going to take a couple years, and I wanted to do something else. So I started learning about aesthetics and kind of where can I get my foot in the door. I took some trainings a few miles out, Dallas area, because I'm from Waco. Was doing that pretty frequently. Like, it was like a 6-month mentorship.
Mhm.
So I was going out there, and then once that was over, I was like, I have to continue. Where can I start? So started doing the groundwork to get my business going, and sure enough, started out, and here we are, a few years later.
Nice. So what also led you to decide to start your own practice? I mean, why not just work for another practice or work for somebody else?
So I like the autonomy. Obviously, I like doing my own hours, and I wanted to be able to start out slow and grow something that I wanted. I did look out to seeing about joining a place and, going from there. But at the end of the day, it just seemed like a better fit for me to start out by myself.
Okay.
Mhm.
And
Mhm.
now that you have this practice, I want to talk about some of the treatments that you offer to your clients,
Okay.
your patients. I want to talk about the personalized treatment plans because that's something that you're quite big on. Tell me
Yes.
about these personalized treatment plans.
Yes. So typically, when somebody comes to me, they either have never had a treatment done. Like I said, I do serve a lot of Hispanic community because they're like, I know I have this. I have either hyperpigmentation or I have, the wrinkles. What can I do? I don't want to look overdone. I don't want to look stiff, is what a lot of people, taboo Botox with and stuff like that. So we sit down, we talk about what areas are their concerns and how we can go about it. Typically, it's a 6 month to a year up to doing different treatments to get to the point where they're happy with their results. Never am I pushing, thousands of treatments all at once, because that's not going to feel natural, especially for those first timers that are coming in. So we start out very slow. Maybe we do some talks here and there, come in a few weeks later to the month. We do some filler retouch, do those regenerative stuff like Sculptra. Then they come in a few 3 to 6 months, see where we are. Do we need to do touch ups? If we're dealing with hyperpigmentation, it's a kind of a different treatment plan from there. But most of my clients, they are very, very happy with this slow and very natural progression, and making sure it's within their budget also. So that's what I love about doing a lengthy treatment plan, because they're able to get small results, but that are going to be long lasting over time.
Okay. So,
Mm-hmm.
and as far as where someone starts with this process, I mean, especially the ones that are brand new, like how does that
Mm-hmm.
conversation usually go? Like the comments like, I'm looking to look younger or have tighter skin, or is, hey, my friend told me about this. I'm not really sure like what it is. Like, where does that process start so that you can start putting together that personalized plan for them?
It really depends. It just like sometimes they're like, I don't like this wrinkle. The forehead wrinkle is very, very common. They're like, I don't like this wrinkle. What can I do about that? Botox, but I'm scared. And so then from there, we talk, okay, maybe a little bit of Botox from there. Sometimes it's the mom that's so tired, she's like, I've had a baby after baby, and I just don't feel like myself again. I'm like, I've lost some weight, I've gained weight, and I feel really, really tired. What can we do? So then we start talking about, doing those regenerative things, that maybe we just need to do a little bit of crow's feet, jelly roll, something to kind of brighten up your eyes. And then from there, we discuss, well, we see a little bit of drooping in the lower cheeks. Maybe we just need to refill that area. Usually, after a little bit of Botox, they feel refreshed, and they're like, hey, I kind of got a little spark in me. So
Mhm.
let's see what else we can do to get that going.
Okay.
Yeah.
And you were talking about regenerative treatments. What
Mhm.
is regenerative treatments? So people that have never heard the term before.
So, like Sculptra is a collagen inducing treatment that we can do. It's polylactic acid. It gets injected in the face area. It can get injected in multiple areas, but mainly to retighten the area. It gives the skin firmness, it gives you a glow, and it grows over time. So, if they see from day 1 to day 30, they may not see much of a difference, but over time, 6 months, they will see the area tightening, they will see a glow, they will see some skin firmness and stuff like that. So with time, these treatments will help overall.
Okay, so the regenerative part of this is really it keeps doing the job after it's been put in. So kind
Mm-hmm.
of compared to like injectables like Botox or filler, which typically would reduce over time. Regenerative treatments, I guess, get stronger over time. Is that correct?
Yes. Yeah. So like Botox, you do it one time, and then 3 to 5 months later, it's pretty much gone, and there's nothing that lasts for a long time. Fillers, they get injected, they last a little bit longer than Botox, maybe 6 months, year and a half, but eventually it may go away. It depends on a lot on their metabolism as well. And then from there, when we do like Sculptra, microneedling stuff to stimulate collagen, those are the ones that they get long lasting effects.
Mhm.
Mhm.
Okay. And so now, can you mix these treatments? Can you mix regenerative medicine with like the Botox or the filler treatments?
Yes, yes, we do. So sometimes we do. Once they come in for like a yearly maintenance or anything like that, then I have a lot of people that are like, okay, I'm ready to do today. I'm touching up my fillers, and let's add a little bit of Sculptra. Let's do the chemical peel. Let's, kind of treat it all at once. And so I do have those clients also that are just kind of on their maintenance
Mhm.
to keep aging backwards, I guess you can say.
So, and you mentioned that these treatments can typically be lengthy. What do you mean by like lengthy? Like, what's the time frame that people can typically expect when it comes to a personalized treatment plan?
Typically about 6 months, 9 months. up to a year, and it's doing treatments once a month, uh, maybe 3 months, stuff like that. Like if we do a microneedling session of 3 to treat some acne scarring, we're coming in every month doing a treatment, at least 3, maybe up to 6 series. And then from there, we evaluate if this needs to be done yearly, by, twice a year. Just depends.
Okay.
Mhm.
And what about the frequency? Like, how often do they need to come back for this? I guess more important, like, what's the, I guess, recovery time in between treatments that they should follow?
So it depends on the treatment. So if we're doing like microneedling, then that is about 30 days. They usually come in. They can come in as soon as 30 days. If they're doing like Sculptra, we space those out. It's about 6 to 8 weeks treatments. And then after that, once they reach the goal, then we can space it out every year.
Okay.
Mhm.
So it's really just trying to get a lot of that front loading that work, and then from there,
Mhm.
when you kind of get to the certain point of what you're happy with, then it's just maintaining after that.
Yes. Mhm.
Got it. Now, I want to understand a little bit more as far as some of the treatments, other treatments that you do. I mean, we talked about the personalized treatment plans, but are there other treatments that you would say is popular or that your clients come to you for?
I do have a lot of clients that come in for IV hydrations and like the wellness side, a weight loss program that I also do. So those in combinations are very good as well. I offer like weight loss programs, meaning like tirzepatide, semaglutide. And then from there, people really lean into those IV hydrations where you get those minerals and amino acids back into your vitamins back into your system where you feel better um, overall.
Okay. So for the IV hydration, then
Mhm.
I've noticed that these have started to pick up a little bit more in popularity, but for people who've never done it before, like what's the, I guess, the difference between taking like an IV hydration and just taking like a multivitamin or something along those lines?
So a multivitamin pill takes usually about, you're supposed to take it daily, but most of us don't ever take our pills daily because we forget or something, especially if it's a multivitamin. And it takes a while for your body to feel the effects of it because it needs to build up like a reserve of them. So typically, if you take it 2 to 3 weeks, then finally you've reached that level where, hey, I may feel the effects of it. Okay. In IV hydration, you get it straight to your IV, which is into your vein. And so you get 100% of the vitamins. It bypasses that breakdown of your stomach having to bypass the pill and break down the vitamin, and you get only certain bioavailability of the pill.
Mm.
So you get a lot faster results in bioavailability of the vitamin through the IV. Mhm.
Right. When you say bioavailable, I guess my understanding of bioavailability is that, I guess we're talking in units. If there's like 100 units in an IV, your body may absorb like 90 of those 100 units. But if you take a vitamin, there may be 100 units, but your body will only take like 10 units. Is that kind
Mhm.
of a fair assessment of how you would look at bioavailability?
Yes.
Okay.
Yes, that's exactly how. Mhm.
Okay. So it's basically you're getting a lot more, I guess, bang for your buck, and you're getting a lot faster as well.
Yes. And a lot of folks, they're like, well, what can I do to continue getting this effects? I'm like, well, you can continue to take your multivitamin at home. You'll just be able to effectively receive it now over if you didn't get the IV hydration because you don't have to wait those 3 weeks to make a reserve of your vitamins.
Okay. And
Mhm.
how do people choose? My understanding is also there's a lot of different types of IVs. So it's kind of like
Mhm.
a menu. It's like, oh, I want energy or I want immune system. Like, I'll take this one. Like, how does that kind of work?
There's definitely an IV menu, of different things, but it also depends what you're feeling. So if somebody had a cold and they're like, "Oh my gosh, I can't get over this cold," then I choose the immunity IV, which is jam packed with vitamin C. It also has glutathione and zinc, and so all those things support your recovery from an illness. Then also, there's some that are like, oh my gosh, I am super, um, like I worked out really hard and my muscles hurt and all this and that, right? So recovering, it's a recovering performance IV. Basically, it has amino acids, it has minerals, it has B complex. And so all of that just helps your body recover faster. It helps with muscle recovery. And so you just feel better. You can still go hard in the gym and, just a little bit better. Especially, I have a lot of people who do competitions,
Mhm.
like, what is it called? Um,
Bodybuilding or strongman or
yeah, like, yeah, like CrossFit competitions. And so then they tend to come in after they've done that to recoup from it. Mhm.
okay. Now, for these treatments that you offer, what are some of the most common misconceptions that you hear from your clients about these treatments?
One of the things that I hear a lot is from the IV hydrations that are like, "Oh, am I going to get fat from it?" Because people think, "Oh, you're pumping me up with fluids, and it's going to make me." And I'm like, "No." Or they're like, "Oh, am I going to like um, just feel jittery from all the vitamins?" I'm like, "No. Typically, you don't feel anything like that. You just kind of feel a little fresher, if anything."
Yeah.
Um, and then other things, like Botox and fillers. Obviously, there's those misconceptions of people that feel like they're not going to be able to move their face at all from Botox. But there are ways to make it a natural movement. And then fillers, people don't want to feel overdone. So there's always that conversation that we have to have. There's filler can be great and placed in the right places. And obviously, there are some filler that has been placed in wrong places that we have to kind of dissolve. We have to have those conversations too.
Yeah.
So, mhm.
And you talked about you have to dissolve some fillers. I'm assuming it's because they went
Mhm.
somewhere else, they didn't do a good job, and so they have to come to you to get it undone and then get it done the right way. So, uh, it, in I guess if someone is looking for a good provider who can really get them the results they're looking for and get them to their ultimate goal, what advice would you have for that person when they're doing their search for somebody? They don't know anybody, they're looking for somebody. What advice would you give that person as they do their search?
I always say look at what your provider is putting out there, if they're showing good before and after pictures, and then always inquiry like, okay, well, what was actually done in this? Is it matching the aesthetic that you're looking for? Because there are some providers that are more natural injectors, and there's some that are a little bit more plumpness, I guess you can say, a little bit more exaggerated, if you would say. So I would say just look if the pictures that you're seeing that they're providing is something that you would like, then that may be the provider. And always have a consultation. Just because you went to somebody and had a consultation doesn't mean that you have to get the treatments from them. Don't ever feel pressure. And that's one thing I always, tell my clients too. Like, well, you can sit down. There's no like gimmick. I can tell you exactly what I recommend. If you want to go home, think about it. 100% think about it. It's a big deal.
Mhm.
You're doing this to your face. So go home, think about it. And then if you want to come back or if you have any further follow-up questions, just reach out.
Mm.
Mhm.
And are there any red flags they need to keep an eye out for when they're doing the search also?
Yes. Yes, I would always, go to a medical provider if, I would always go to a medical provider. There's a lot of, Botox that is, right now, big controversy about it's really, really cheap, or, if it's too cheap, then it's probably not real Botox, diluted Botox. I don't know, something like that. But
Mm.
I would always say, look at the pricing. If the pricing seems too good, um, just look at, who the provider is and stuff like that. Mhm.
Now, in what you do, how important is it to have an artistic eye in what you do? Because I think when people think about medicine, they're not thinking about artistry. But I mean, what's your thoughts on having how important an artistic eye is for what you do?
It definitely is. You have to be very vigilant to detail, looking at somebody when they're animating or when they're, just talking to you in general. You just look to see those features that they have uniquely to them. And so I think that's where my critical care really comes into detail, because my clients will be like, oh my gosh, Ruby, I didn't really notice that. Or, you're pointing this out. And I'm like, no, 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 I'm not trying to be critical of you, but I just want you to notice it, because everybody has a unique feature. And I just want you to know that this is your unique feature and this is what we can do. Not that I'm like nitpicking them, but, and then they're like, okay, they understand.
And when it comes to the educational portion of this, because you did mention earlier that some of these people are brand new to this. So how do you approach that educational component of it where they just don't know what this is? They don't know what's going to happen. They have a lot of maybe fear or doubt of what's going to happen. Like, how do you approach that educational part of this?
Yes. So I'm a big educator in my practice. I always, I'm telling them everything beforehand as I'm doing things to, I'm like, look, I'm going to do this. I'm going to mark you. I'm going to clean. I'm going to do my capillary field check. I'm just teaching them as I'm going. And then, that just puts them at ease. And then after we go over all the treatments, they get a information packet after they leave also. And then I follow up with them the next day just to make sure, do you have any questions, any concerns? And I always make them come for a follow up as well after any treatments, just to make sure that they got the results they liked, if there's anything they were concerned with, or just to make sure they're happy.
Now, Ruby, I'm sure that throughout your experience, you've had some memorable cases or challenging cases. There's maybe one story that comes to mind that you can share of just memorable case, tough case, and how you were able to get them a great result in the end.
Yes. So one of the cases, somebody had a like lip deformity on one side, and they were very conscious about it. We were able to just fill in a little bit of filler in that area, not really to give her anything huge, but just give her a little bit of more symmetry. And we did the same thing with another client with Botox, a little bit of pull on one side of her lip from Bell's palsy. And so it just kind of helped give her a little bit more of a symmetrical smile. And so they were really, really happy with the results. And so they're like, oh my gosh, I didn't know this was something that we could do. And so they were super, super happy and just grateful for it. And so it gives me that like, oh my gosh, I am doing something different.
Yeah,
Yes.
that's great.
Mhm.
That's great. These stories, I think it's important to share these because when people think about the aesthetics industry, they don't think about a lot of these people just want to feel normal. They just want to look like everybody else or just be the best version of themselves. It's not about trying to be the best looking person in the room. It's just you want to get their confidence back. So I think
Mhm.
it's important to share these types of stories. So now, Ruby, where do you think the future of aesthetics is going?
It's growing. It's definitely growing. There is a lot of new learning or new products out there, technology. And so I just feel like, we just, as providers, we have to keep up to date with all of that. And it's a never ending learning curve for us.
Mhm.
And that's just with medicine in general. There's always going to be new medicines, new techniques, new protocols. And so just learning and keeping up with it, and that just gives our patients the best results.
Mhm. Okay. And with your practice, Bella Ruby, what is your vision for your practice?
Well, I've been a solo provider for quite some time, since the beginning. I would like to grow into a bigger space eventually, and continue maybe providing more of the wellness side of it as well. And just having estheticians and other nurses under me as well. But it's a growth in progress. Yeah.
Well, Ruby, I have one last question for you, but before I ask it, I do want to point people to your website at bellarubyaesthetics.com.
Yes.
Now, last question is, what does beauty mean to you?
Beauty means to me, it means whatever the person holds it. It's saying, hi, I'm here, just a glow to their eye, oh my gosh, I don't know. Beauty means everything. It's literally Bella. Bella, it means beauty. So
It's perfect. Perfect question
it's
for
me and
everybody.
you.
Okay, sounds good. Well, there you go. Ruby sharing your expertise. So, Ruby, where can people contact you and your practice?
Yes. So they can contact me through bellarubiaesthetics.com. There's a contact info there. They can reach out to our line 254-537-3381. And then we also have aestheticrecords.com where we have our booking site.
Awesome. Well, Ruby, this is great. Thanks for coming on and thanks for sharing your message.
Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.